New at 10, state health officials looking for public feedback to identify issues surrounding the fight against HIV. Numbers of positive cases are up across the state. South Carolina is one of 7 states, part of a national strategy to end the HIV epidemic by 2030.
Robertson joins us live in Greenville at why HIV numbers are increasing in the state. Jarvis?
Cody, according to health officials, 16% of people living with HIV in South Carolina don't even know it. For that reason, DHEC is looking to ramp up their efforts in spreading HIV prevention.
What we want to see ultimately is there to be a decline in the number of new cases.
DHEC, along with advocacy partners, are hoping to increase HIV awareness to put an end to a disease that has claimed so many lives.
Ending HIV epidemic would be prevention efforts.
5 to 6 people per day for testing, and that's only because we need an hour between each visit to disinfect.
COVID-19 did cause a decrease in testing for the entire state. I'm told there was a 60% decline between the first and second quarters of the year. However, in our region, I'm told the numbers are relatively equal to last year's testing-wise.
In March, I believe, or in April, when everybody was shut down, we did see a small decrease.
Rural areas draw more of a concern for advocacy and health officials because of the lack of health care. Among them, priority targets are seeing a steady increase in rates of infection,
which is African American males in the area here.
Interestingly, we did see an increase in our positivity rate for HIV testing in the second quarter.
DHEC hopes to identify barriers that affect prevention with their forums. I'm told stigma surrounding HIV, financial resources, and education are some of the problems facing the growing epidemic. But $1 million in grant funding from the Health Resources and Services Administration will aid in that fight.
Likewise, we are really happy to see that we got full funding for our prevention for HIV through the CDC. We previously were operating with about $5.1 million federally, and we have been given an additional $2.7 million.
Now, no area of the state is immune to HIV, but the Midlands is the area that has seen a greater need for care. Now, those forums will start tomorrow evening at 7 o'clock. We'll have a link in our news app about how you can sign up if you would like to virtually attend. Reporting live in Greenville tonight, I'm Jarvis Robertson, Fox Carolina, the 10 o'clock news.